Hello, this is the third lecture. We will talk about renal function test. Let's see. Physiology shows that there are many metabolic function and chemical interaction can be determined through the laboratory test for the renal function. The renal function tests are glomerular filtration test and tubular reabsorption test, tubular secretion, and renal blood flow test. Glomerular filtration test, clearance test are aniline clearance, creatinine clearance, radionucleotide 125I isolamate, beta 2 microglobin, cystatin C. Glomerular filtration test, as we say, clearance test. The clearance test measure the rate of the kidney are able to remove the filtrate substance from the blood or from the plasma. When the plasma ultrafiltrate enters the proximal convoluted tubule in the nephron, the cellular transport mechanism start reabsorbing essential substance and water. Other factors are considered in selection of substance for clearance test include the stability of substance in urine during possible 24-hour collection time. The substance is available in the body and the plasma. The availability for tests which determine the substance. Clearance test, the earliest glomerular filtration test measure is urea because of present urea in the plasma and urine. The method which determined the urea is available at element of urea clearance from the filtration test due to approximately 40% of filtrated urea is reabsorbed, so it's used to estimate the reabsorption function, not for clearance function. So measure urea as a test substance for glomerular filtration has been replaced by aniline, creatinine, beta 2 microglobin, cystatin C, and radioisotopes. Aniline clearance. Aniline is polymer of fructose, which suitable substance, not reabsorbed, not secreted by tubules, not normally found in the body, must be infused at the constant rate through the test period. But the test that required an infused substance is called exogenous procedure and is rarely choose this method when the suitable substance for the test already present in the body, endogenous procedure. Although aniline was the original reference method for a clearance test, but now is not used for glomerular filtration test. Creatine clearance. Creatine is a waste product for muscle metabolism. It's normally found in the blood. Provide endogenous procedure for estimate GFR, but using the creatinine has several disadvantages which not found with aniline. These disadvantages are some creatinine is secreted by tubulars, and this secretion increases when the creatinine blood level high. Chromogen present in the human plasma, and these react with chemical analysis, which make falsely elevated in the result. Medications such as gentamicin, cephalosporin inhibit tubular secretion of creatinine and others, causing falsely low serum levels. Bacteria will break down the urinary creatinine if specimens are kept at room temperature for a long time. Measurement of creatinine clearance is not reliable in patients suffering from the muscle wasting disease. Creatinine clearance test provides the clinical laboratory with method for screening GFR. Now we will talk about the procedure. The greatest source of error in any clearance procedure is the time which collect the urine. To calculate this information, must know the urine volume and urine creatinine concentration and the plasma creatinine concentration. As we see, example, urine creatinine is 120 mg per deciliter and plasma creatinine is 1 mg per deciliter, and urine volume is 1440 milli obtained from 24-hour specimen. And as we see, this equation V equal 1 milli per minute and clearance equal 120 milli per minute. To discuss the last example, we must know 1 milligram per creatinine in the plasma is equal 0.01 milligram per milli, and 120 milligram per deciliter urine creatinine equal 1.2 milligram per milli creatinine. So necessary to clear 120 ml of plasma. Although the filtrate volume is reduced, amount of creatinine in the filtrate doesn't change because the creatinine is not reabsorbed. Creatinine clearance value in the man 107 to 139 ml per minute. In woman 87 to 107 ml per minute. The normal plasma creatinine is 0.5 to 1.5 milligram per deciliter. Creatinine clearance is not light in the detection of early renal disease, but it's used to determine the extent of nephron damage and prevent the further damage for nephrons. As you see, this is diagrammatic. The plasma 1 milligram creatinine equal 0.01 milligram per milli. Come to glomerulus, then the filtration with 120 milli per minute equal 1.2 milligram. As we know, the volume for filtration 1 milli per minute, so the reabsorption in 119 milli H2O and complete to renal tubular 1 milli per minute. Creatinine contain 1.2 milligram or 120 milligram per deciliter creatinine in the urine. Radionucleotide 125-ioisosalamate. The development procedures measure disappearance of infused substance from the plasma. This method used because enhanced interest in exogenous procedure and eliminating the need of urine collection. Like injection of radionucleotide, where this method provides determination of glomerular filtration through the plasma disappear of radioactive material and enable visualization for one kidney or both about the filtration function for him. The beta-2 microglobin. Beta-2 microglobin molecular weight 11,800 kilodalton, dissociated from the human leukocyte antigen at constant rate. It's rapidly removed from the plasma by glomerular filtration. By estimation, beta-2 microglobin find the elevation in the plasma show more sensitive indicator than the creatinine clearance. But the test is not reliable in patients who have history of immunologic disorder or malignancy. Cystatin C. Cystatin C is a small protein produced at constant rate by nucleotide cell, used to monitor the glomerular filtration rate. It's filtrated by glomerulus and reabsorbed and broken down by renal tubular. So no cystatin C is secreted by the tubules, and the serum concentration can be directly related to the GFR. Thank you. With my best wish for success, Dr. Fahim. This is third lecture in renal function test.